In a big boost to the states in the fight against coronavirus, the centre has approved COVID-19 emergency response and health system preparedness package. 100% financial aid economic package will help the states procure essential medical equipment and medicines. 15,000 crore rupees to be given in 3 phases from January 2020 to March 2024. GOM on COVID-19 discusses issues of masks, ventilators and separate dedicated COVID hospitals. The centre says no shortage of personal protective equipment. 20 companies are manufacturing PPEs. 49,000 ventilators being procured. The number of coronavirus cases in India goes up to 5,218. 169 people have lost their lives due to the pandemic so far. 477 people have been discharged after successful treatment, and the centre has dispatched 10 high-level teams to 9 states to enhance cooperation. The police is maintaining a strict vigil in sealed areas of Delhi and Uttar Pradesh. Movement of people has been stopped. Authorities have ensured door-to-door delivery of essential items in such areas. Delhi government is running Operation Shield in hotspot areas. Number of new cases rises rapidly in Maharashtra and Madhya Pradesh. Maharashtra has the highest count of COVID-19 patients. The death of corona-infected doctor in Indore, Madhya Pradesh. Odisha extends the duration of the lockdown till April 30. Many states make wearing a face mask mandatory. Prime Minister Narendra Modi's efforts to collaborate with countries around the world on COVID-19 continues, and the Prime Minister talks over the phone with the President of South Korea and discusses the challenges of COVID-19. The US President Donald Trump and the Brazilian President express their gratitude. The Prime Minister replies that India shall do everything possible to help humanity's fight against COVID-19. The war against the coronavirus continues in the world. About 1.5 million people have been infected so far, and more than 88,000 people have died. The US, Italy and Spain have the highest number of deaths, and 100 doctors have died in Italy. Our top story: the centre has approved a comprehensive package to provide assistance to the states in the fight against COVID-19 pandemic. COVID-19 emergency response and health system preparedness package, the 100% centrally funded scheme, is aimed at enhancing the infrastructure in states to meet the coronavirus epidemic challenge. This package was called the India COVID-19 Emergency Response and Health System Preparedness Package. And under it, the Government of India has sanctioned 15,000 crore rupees for India COVID Emergency Response and Health System Preparedness Package. Of the funds sanctioned, 7,774 crore rupees will be utilized for immediate COVID-19 emergency response, and the rest for medium-term support. The project will be implemented in 3 phases. Phase 1 will be from January 2020 to June 2020. And Phase 2 will be from July 2020 to March 2021. Phase 3 from April 21 to March 2024. The key objectives include mounting emergency response to slow and limit COVID-19 through development of diagnostics and COVID-19 dedicated treatment facilities. So we can see that the project is implemented in 3 phases. The key objectives as we are reading out. So let's move on then. This is one of the key objectives: mounting emergency response fund. Also, centralized procurement of essential medical equipments and drugs are required for treatment of infected patients. Strengthening and building resilient national and state health systems to support prevention and preparedness for future disease outbreaks. Setting up of laboratories and bolstering of surveillance activities, biosecurity preparedness, pandemic research, proactively engaging with communities and conducting risk communication activities. The Prime Minister, in his address on to the nation on the 24th of March, had highlighted that the central government has provisioned 15,000 crore rupees for treating coronavirus patients and strengthening the medical infrastructure of the country.
अब कोरोना के मरीजों के इलाज के लिए देश के हेल्थ इंफ्रास्ट्रक्चर को और मजबूत बनाने के लिए केंद्र सरकार ने आज 15,000 करोड़ रुपए का प्रावधान किया है। इससे कोरोना से जुड़ी टेस्टिंग फैसिलिटीज, पर्सनल प्रोटेक्टिव इक्विपमेंट्स, आइसोलेशन बेड्स, आईसीयू बेड्स, वेंटिलेटर्स और अन्य जरूरी साधनों की संख्या तेजी से बढ़ाई जाएगी। साथ ही मेडिकल और पैरामेडिकल मैन पावर की ट्रेनिंग का काम भी किया जाएगा। मैंने राज्य सरकारों से अनुरोध किया है कि इस समय सभी राज्यों की पहली प्राथमिकता सिर्फ और सिर्फ स्वास्थ्य सेवाएं ही होनी चाहिए, हेल्थ केयर ही प्राथमिकता होनी चाहिए।
Now, as of date, a total of 223 labs comprising a network of 157 government and 66 private laboratories are conducting rigorous screening process. Furthermore, the Ministry of Health and Family Welfare has already disbursed 4,113 crore rupees to the states and union territories for dealing with the emergency COVID response fund. Now, the centre has also prepared teams to coordinate with the states on crucial aspects of logistics and infrastructure support in the fight against COVID-19. The government has also said that supplies of PPEs, masks and ventilators have now begun. 20 domestic manufacturers in India have been roped in to make the PPEs, and orders for 1.7 crore PPEs have been placed. Also, according to the centre, the supplies have already begun. Apart from that, the government has also placed orders for 49,000 ventilators. The government has also said that there is no need to panic as far as the availability of essential equipment is concerned. Now, the number of active COVID-19 cases in the country has risen to 5,218. This is according to the Ministry of Health and Family Welfare. 169 people have lost their lives to the disease, and as many as 477 people have been cured and discharged, and one has migrated. Well, a high-level meeting of the group of ministers on COVID-19 was held in New Delhi under the chairmanship of Dr. Harsh Vardhan, the Union Minister for Health and Family Welfare. So a group of ministers had detailed deliberations on containment and management of COVID-19. The GOM also discussed actions taken so far, the current status of social distancing measures as a preventive strategy, and the stringent actions taken by the centre as well as the states to contain the spread of COVID-19. Several other measures about strengthening capacity of the states, including devoting adequate resources for creating dedicated COVID-19 hospitals, equipping the medical institutes with PPEs, ventilators and other essential equipment, were also discussed in detail. The states have been asked to identify COVID-19 centres, hospitals, according to the already laid down guidelines. The GOM also reviewed the testing strategy and availability of testing kits across the country, along with the strategy for hotspots and cluster management. The GOM was apprised of the situation regarding the adequacy and availability of PPEs, masks, also ventilators, drugs and other essential equipment against the requirements. The GOM was informed that domestic manufacturers have been identified and production of PPEs and orders have been placed. In addition, the order for ventilators has been placed. The GOM has been briefed about the number of public and private labs that are presently testing for COVID-19, along with the number of tests that are being conducted every day through the network of labs. The GOM will also reviewed the status of the implementation of the Pradhan Mantri Garib Kalyan Yojana. The GOM expressed satisfaction over the work done by the ministries and the empowered groups. The Delhi Chief Minister Arvind Kejriwal has warned of strict action against those misbehaving with healthcare personnel. 20 areas have been identified as containment zones in the national capital, and people are not being allowed to enter or exit these areas.
Delhi Chief Minister Arvind Kejriwal on Thursday warned of strict action against those misbehaving with healthcare personnel in the city in the wake of coronavirus outbreak. Kejriwal said 21 areas had been identified as containment zones in the national capital and people were not being allowed to enter or exit these areas.
S का मतलब सील कर दिया, तो शील्ड का H का मतलब होम क्वारंटाइन कर दिया, I का मतलब आइसोलेशन एंड ट्रेसिंग, E का मतलब एसेंशियल सप्लाई, L का मतलब है लोकल सैनिटाइजेशन और D का मतलब है डोर टू डोर चेकिंग की जाती है.
Himachal Pradesh has said that all the cases in the state are related to Tablighi Jamaat members and efforts are on to ensure that all those who exhibit symptoms will be tested.
अभी तक हिमाचल प्रदेश में हमने 50 लाख का जो है एक्टिव केस फाइंडिंग का प्रोसेस कंप्लीट कर लिया है. जो जितने भी मामले इस प्रकार के थोड़ा से भी दिखते हैं, सिम्टोमेटिकली दिखते हैं, उसमें आशा वर्कर जा रही है, आंगनबाड़ी वर्कर जा रहे हैं, हमारे मेडिकल डिपार्टमेंट के हमारे हेल्थ वर्कर्स जा रहे हैं और ये पूरे प्रदेश भर में चला है. तो ऐसे में कह सकता हूं कि हमने बहुत गंभीरता से सारे विषय को लिया है.
Uttar Pradesh has decided to seal the hotspot areas in the state. Administration has assured of uninterrupted supply of essentials in the sealed areas.
हॉटस्पॉट्स के क्षेत्र में आवश्यक वस्तुओं के डोर टू डोर डिलीवरी के लिए दूध, राशन, फल सब्जी की व्यवस्था के लिए भी अलग से समीक्षा करने का निर्देश उन्होंने वरिष्ठ अधिकारियों को दिया है. इसके साथ साथ हॉटस्पॉट्स के क्षेत्र में PRV 112 यानी UP 112 की गाड़ियों को भी स्टेशन किया जाएगा.
The Odisha government has decided to extend the ongoing lockdown in the state till April 30 to effectively contain the spread of coronavirus. Schools and other educational institutions will remain closed till June 17. Chief Minister Naveen Patnaik announced after a video conference with his ministers. Patnaik said the state has also urged the centre to stop train and flight services to Odisha till April 30.
उड़ीसा सरकार ने घोषणा की है, राज्य में लॉकडाउन अप्रैल 30 तक एक्सटेंड किया जा रहा है और सभी स्कूल्स और कॉलेजेस जून 17 तक बंद रखा जाएंगे. इस डिसीजन की पालन करने के लिए भारतीय जनता पार्टी हर किस्म की सहयोग करेगी और हम जनता को अपील करते हैं कि सरकार की सभी नियम, कानून और गाइडलाइंस को जरूर फॉलो करें.
A 62-year-old doctor who had tested positive for coronavirus died in Indore on Thursday. Dr. Praveen Jadia said that the victim, who was a general physician, breathed his last at a private hospital in the morning. Authorities on Wednesday sealed Indore, Bhopal and Ujjain districts to control the spread of coronavirus.
18 जिले अब तक मध्य प्रदेश में संक्रमित हो गए हैं. मैंने 3 जिले, 3 शहर महानगर, इंदौर, भोपाल, उज्जैन को पूरी तरह से सील करने के निर्देश दिए हैं. इन शहरों में ना कोई अंदर जाएगा, ना इनसे कोई बाहर जाएगा. ये व्यवस्था पूरी कड़ाई के साथ हम लागू करेंगे.
Wearing mask has been made compulsory in the cities like Mumbai, Pune, Nasik and Nagpur, where coronavirus has spread on a big scale, Maharashtra Minister Anil Deshmukh said on Thursday. He also urged the residents of these cities not to step out of their homes without covering their mouths. Haryana government has said that the salary of all those who are fighting the COVID-19 disease will be doubled.
कि जब तक ये कोरोना इसका पीरियड चलेगा, तब तक ये सारा स्टाफ जो सीधा कोरोना के पीड़ित मरीजों की कोविड की एक इलाज में लगे हैं या उनके संभालने में लगे हैं, इनकी सैलरी अब डबल रहेगी.
All the state government are working cohesively to fight the COVID-19 menace to ensure that the nation wins the fight. Bureau Report, DD India.
Well, the national capital has 669 active cases of coronavirus. 20 hotspots in Delhi have been sealed, and 22 places in the neighboring Gautam Budh Nagar or Noida were also sealed. So the main purpose of sealing is to arrest the transmission of the virus through quarantining an entire area in a sense, and it also helps the authorities to go house to house and do an evaluation of the virus in a potential cluster.
With the number of cases of COVID-19 still increasing, the government has adopted a cluster-controlled containment strategy. Steps are being taken to prevent the spread of the virus by sealing off identified hotspots. 20 such hotspots in Delhi were sealed on Wednesday. Similar measures were taken in 15 districts of Uttar Pradesh. Apart from sealing 20 hotspots in Delhi, the government has made it mandatory to wear masks while outside one's home. People in the sealed areas are not permitted to leave their homes at all, and essential supplies will be supplied to their homes. Streets and roads were deserted as people complied with the stricter lockdown. Delhi government is ensuring supply of essential items.
आप अगर इसको लॉकडाउन को फॉलो नहीं करेंगे तो फिर बढ़ेगा और ज़्यादा दिक्कत आएंगी। अभी देखिएगा ये बहुत ही डिस्ट्रेस सिचुएशन है, इमरजेंसी टाइप सिचुएशन है कि हमारे को अपनी सारी मूवमेंट को कर्टेल करने की ज़रूरत है। अगर आपको बहुत ज़रूरी सामान लेने जाना है तो दिन में एक बार ही जाइएगा और सारा सामान इकट्ठा लिएगा, बार-बार ना जाएं।
Among the 15 districts in Uttar Pradesh, 22 specific places in Gautam Budh Nagar or Noida were declared hotspots and sealed. Sealing means movement within these 22 hotspots is completely restricted, with no one allowed inside or outside. The administration is sanitizing the hotspots. The fire department has also been roped in to assist in sanitizing the area. Supply of essential items is the only form of movement allowed in the areas. Government employees and local volunteers are assisting in supply of milk and vegetables directly to people's homes. District Magistrate and Police Commissioner have been visiting the hotspots to take stock of the arrangements themselves.
लॉकडाउन की प्रक्रिया को सफल बनाने के लिए आपका सहयोग ज़रूरत है और ये आप ही के लिए किया जा रहा है, आपकी वेलफेयर के लिए किया जा रहा है और प्रशासन इस बात को समझ रही है कि थोड़ा बहुत असुविधा हो रही है, बट कोशिश यही की जा रही है कि आपके घर तक, आपके सोसाइटी तक दूध, फल, सब्जी, ग्रोसरी सब पहुंचाई जा रही है, दवा पहुंचाई जा रही है, आपको कोई तकलीफ ना हो।
जो इंटीग्रेटेड हमारा कंट्रोल रूम है उस पे डेली रिक्वायरमेंट्स के बारे में है और कुछ लोग हैं जो थोड़ा सा भी आत्म संयम नहीं दिखा पा रहे हैं, वो किसी तरह से पास लेने के बारे में बात कर रहे हैं। उनसे मैं अपील करना चाहूँगा कि जन स्वास्थ्य से जुड़ा हुआ ये मामला है, कृपया आप जहाँ हैं वहीं रहिए और आपकी सारी जो आवश्यकता है उनको वहीं पूरा किया जाएगा।
The administration is using drones to monitor any unauthorized movement in the sealed hotspots in Meerut.
वर्तमान में एडमिनिस्ट्रेशन द्वारा 12 हॉटस्पॉट चिन्हित करके उनको पूर्ण रूप से सील किया गया है। इसमें आम पब्लिक का मूवमेंट पूर्ण रूप से प्रतिबंधित है, कोई भी घर से नहीं निकलेगा। जहाँ पे एसेंशियल सप्लाईज़ की ज़रूरत है वो हम लोग इंश्योर करेंगे, डोर स्टेप डिलीवरी। मेडिकल इमरजेंसी अगर कोई होती है तो उसको हमारी एम्बुलेंस उसको अटेंड करेगी और आपको खुद घर से बाहर निकलने के लिए ज़रूरत नहीं है।
Strict action will be taken against any person violating the sealing orders. The government on its part is taking these measures in the larger interest of the community and seeks the cooperation of everyone. With Rajiv Rastogi from Delhi, Arindra from Noida and Anuj Yadav from Meerut, Bureau Report, DD India.
Well, today is observed as Shaurya Divas to honor the valor of the Central Reserve Police Force. President Ramnath Kovind, Prime Minister Narendra Modi and Home Minister Amit Shah extended their wishes, remembering the courage of the force, and they paid tributes to martyrs on the occasion.
The whole country is celebrating Shaurya Divas to commemorate the defense of the Sardar post by the Central Reserve Police Force in the run of Kutch at the onset of the Indo-Pak War of 1965. The historic day was 9th April 1965 when the Pakistan Army carried out the Desert Hawk operation to capture Indian territory bordering Pakistan. On the intervening night of 8th April and 9th April in 1965, a whole infantry brigade of Pakistan attacked the Sardar post. 2 companies of the 2nd Corps of CRPF were stationed there. Recalling the bravery of CRPF, President Ramnath Kovind said that the CRPF knights posted in the security of the country with their valor and patriotism wrote a golden history on the Sardar post of Gujarat on 9th April 1965. Congratulations to everyone and tribute to the martyrs of Shaurya Divas, celebrated in memory of that unusual valor and sacrifice. The battle lasted for 12 hours. In the end, the Pakistani army fled the battleground, leaving behind 34 of their men dead, which included 2 officers. Another 4 soldiers were captured alive. On that night, the CRPF lost 6 of its brave soldiers. Ever since, the day is celebrated by the CRPF as Valor Day. This bravery was saluted by Prime Minister Narendra Modi. Appreciating the courage of the force, the PM said, "The courage of CRPF is widely known. On CRPF Valor Day, I salute this brave force and remember the bravery of our CRPF personnel in Gujarat's Sardar Patel post in 1965. The sacrifice of the brave martyrs will never be forgotten." Home Minister Amit Shah has also saluted the bravery of the CRPF on Shaurya Divas. He said, on 9th April 1965 at the Sardar post located in the run of Kutch, Gujarat, a small contingent of the CRPF created history by defeating the enemy army several times larger than them. Congratulations to everyone and salute our brave martyrs of CRPF, a symbol of indomitable courage, valor and sacrifice on Shaurya Divas. The 1965 war was one of the historic wars in the world, in which a small contingent of police force not only forced the huge brigade of the enemy to kneel down, but also drove it out. April 9th is celebrated as Shaurya Divas to honor the unwavering valor and courage of our CRPF soldiers. With Bureau Inputs, Sudhakar Das's report, DD News.
The villagers of Ditla village of Amreli district of Gujarat have scripted new history. The farmers have returned the money they got in PM Kisan Samman Nidhi, and they have given this to the PM Cares Fund to fight coronavirus. Indeed, a great initiative.
गुजरात राज्य के अमरेली डिस्ट्रिक्ट के धारी तहसील के दिखला गांव के जो छोटे किसान हैं वो सब किसान ने तय किया है कि देश के प्रधानमंत्री नरेंद्र भाई मोदी कोरोना के सामने जंग लड़ रहे हैं और सारा देश इसके साथ जुड़ा हुआ है। नरेंद्र भाई मोदी ने किसानों के लिए, किसान के हित के लिए जो किसान सम्मान निधि योजना तय की है और किसान के अकाउंट में 2-2 हजार रुपया जब ये भेज रहे हैं, तब ये सब किसान वो वापस भारत सरकार में भेज रहे हैं और किसान ये नरेंद्र भाई मोदी के साथ कोरोना के सामने लड़ने के लिए खड़ा हुआ है।
हमारा गांव के सभी दितला गांव के सभी खेडूतों ने यह तय किया है कि 2-2 हजार रुपया का चेक जो प्रधानमंत्री सेवा निधि के अंतर्गत जो खेडूतों को दिया गया है अप्रैल महीना का हफ्ता, तो वो हम वापस करके सरकार को मदद करना चाहते हो। सरकार ने इस विकट समय में भी हमें 2-2 हजार रुपया सभी खेडूतों को देकर उसने अपनी जिम्मेदारी पूरी की है, पर हमारी भी जिम्मेदारी होती है कि जब सरकार इस महामारी के साथ जुड़ रही है तो उसको सहयोगी बने।
And going back to our top story, which is about COVID warriors, we are now joined on Skype by Dr. Randeep Guleria, who is the director of the All India Institute of Medical Sciences. Thank you very much, Doctor, for being with us. So we are putting into focus really the sacrifice and service of people like you on the front line. It's important, one needs to understand the kind of pressures that doctors go through at a time like this. And the government also is talking now of raising the number of PPEs, with an order of 1.7 crore PPEs have been placed. How important is personal protective equipment for doctors at the front line right now?
So a large number of doctors are now in the front line, and I would say not only doctors but all healthcare workers. Yes. That includes the nursing staff, the residents, and all the other workers who are working in ICUs, in wards, trying to save lives and look after these patients who have COVID-19 and who are infectious and can give the infection to those who are caring for them. So having proper adequate PPE is very important, because those people who are the frontline warriors, especially looking after these patients, need to be protected. There is a lot of fear and worry among these health workers that they may get the infection or they may carry the infection home and yes. give it to their family members. And therefore, I think it's important that PPE be available for everyone, and it's for the people who really need it that it should be provided.
And also, well, I mean